So my name is Dr. Marcia Adler, and I started life as a nurse, and so I'm very well affiliated with this topic, and I currently have a PhD and teach public health at UNO. Health literacy is an issue in every demographic, every population, every encounter that a person has with a healthcare provider, whether it's at a pharmacy, whether it's in a physical therapy clinic, or whether it's with a physician. Health literacy is the dictator of who is successful with the treatment outcome and who fails the treatment outcome. It holds the cards for the whole outcome. Generations ago, we didn't teach it. We just assumed everybody understood English. We just assumed everybody could read all the fine print on labels. We just assumed everybody kind of did what they were told. And in my grandmother's era, we treated physicians like they were gods and they just knew the answer, or they were supposed to know what's right by us, and we just did what they said. As we got more kinds of medication, more kinds of physicians, more kinds of diagnostic treatment, that was no longer a reality, because who can walk away from an ultrasound experience and be able to articulate what the doctor just told you? And if you're in a room with a technician that's doing some aspect of your care, they're using language that probably is not language that we would use on a day-to-day basis. So if we absolutely just ignore health literacy, which I can tell you legally, ethically, morally, it's so powerful, that would be a catastrophe. So if we did nothing with that, we would create even a bigger gap in the healthcare delivery system, in the educational system. We would create a bigger gap of people that get it and people that do not. And so the people that get it would be the people that have the most education. The younger, physically fit people would get it because their ears work better, the brains work faster. Even a PhD at UNO, if I went into a discussion about their medications, there's a good chance that they won't capture any of what I'm talking about, because if they didn't study chemistry or they didn't study microbiology, I might as well be speaking French. Because they can't process what I'm talking about. I have a brother who's an engineer, and when we talk about health things, he said, I don't know why you health people think you had to create your own language. This is a really smart person that figures out airplane instrument panels, and he thinks I created a language. So each discipline has its own specialty language, and we've done that somewhat so we can communicate to one another. But health literacy is so across the board and so essential. So if I'm working with a mom and I'm working with trying to get this mom to put eardrops in a pediatric patient so that they can fix an outer ear infection, something that's common. Children get it from swimming pools. If a child is a certain age, I need them to pull that ear up. If a child is a younger age, I need to pull out so they can even administer the medication properly. And so that little ear up or ear out can make a big difference on whether I'm actually able to provide the medication properly. So if I can't do health literacy and demonstrate health literacy and say it in a way they get it, a child might not get their treatment. Oh, I've absolutely seen things that go bad, because I've seen medications not started or not taken. I had a patient who English was not their dominant language and English was not their cultural reference, came in for a situation, was given a prescription and sent home. That same person didn't go fill the prescription. That night, they went over to the hospital. So they've had one doctor visit, went over to the hospital with the same problem and got the second identical prescription, and then came back. So now we've paid for 2 appointments, came back to me with 2 prescriptions and said, what should I do about this? Because in their world, when you go to the doctor, they give you medicine at the doctor. In their world, you don't have to, so they didn't even understand the prescription part. So, and I still felt bad in the evening, and I saw the doctor in the daytime and he did not give me pills. So they went to the emergency room and now they have 2 pieces of paper with, and I loved it. There was 2 identical prescriptions. So I knew the med order was right, but now what do I do with this? I've had another situation, this is health literacy. A student went to the emergency room and didn't have their insurance card, so they borrowed one from somebody that they were with. That's like insurance fraud. You can go to jail for that. This was just somebody that needed the pass to get into the emergency room. Give me your card, I got to get in here. So they didn't even have, so that's an example of health literacy. People didn't know how to use the healthcare system. So I'm giving you college student examples, not foreigners that don't read the culture. These are people that were able to navigate airlines to get here and find their way and all that. I just think this is a super important topic. I think that everybody that has the opportunity to go to college needs to get informed about health literacy, because it's probably in some ways as important as getting a driver's license, because it determines whether we're going to be healthy or not. It determines whether I can run that next marathon or not. It determines whether I can do well in school or not. So it's tied to everything.
Hi, my name is Angie. I'm a student at UNO. Also, I am an advocate for the health literacy within the community. I volunteer at Charles Drew Health Center. It is a community health center that provides services for the families in the community, and we serve families with various health-related issues. Health literacy indeed is an issue. We get patients from all walks of life, so we deal with this issue on a daily basis. One of the ways that we address this issue here at our clinic is by providing different services for our patients. For example, we will translate documents in their respective native language. Also, we take into account the fact that they might not be able to read in their own language, so we provide translators for them. And I occasionally translate for Spanish-speaking patients. Health literacy is such an important issue because the consequences could be grave, and we as a community should help out by volunteering and spreading the words on this issue.